Hello, good afternoon. Dr. Chudi of Aspirations Global Health Solutions. Thank you and welcome to my weekend clinic. Today's clinic is going to focus on simple 5 practical tips that will help you to become pregnant in the month of May. So May is a very critical month. May is the last month before we enter the quarter of 2024. So once we are done with May, we are pretty much left with 1 month. When we get to June, we begin the second half of 2024. So I hope you've been able to leverage on all the opportunities, all the educational materials, the information we've been sharing with you regarding starting your family. So what I intend to do in the next few minutes is to share with you 5 practical tips that will help you for this fresh month of May to achieve pregnancy. Today is already the 4th of May. So we have 31 days in May. If you are able to apply the 5 practical tips, possibility you will end up becoming pregnant before May ends is very high. So make yourself comfortable. I'm going to quickly start. And once I'm done, you will have an opportunity to also ask questions. Now, every woman should be reminded that the reason why God gave you your female reproductive system is actually to be a mother. So you were actually designed as a mother from your mother's womb. So you need to be very conversant with the female reproductive system. So you need to be very conversant with the vagina. So this is the vagina. Beyond the vagina, when you begin to go up, you will get to this beautiful junction. This beautiful junction is called the cervix. So the cervix is the junction between the vagina and the womb. So this is the womb. So you can see how beautiful the womb is. Pretty much structured to carry your baby. So the vagina, the cervix, the womb, and the tubes. So you also have 2 tubes. But the most important part of your female reproductive system that will ensure you become a mother are your ovaries. So your ovaries are where you have the eggs. When you release the eggs during ovulation, and if there is availability of sperm, the sperm will fertilize the eggs and they will form an embryo. When they form an embryo, the embryo will move from this tube back into the womb and it will start developing. At the end of 37 weeks, that pregnancy is considered 10. At the end of 42 weeks, everything going okay, you're going to go into labor. When you go into labor, there will be hormonal changes in the womb and the cervix. The cervix will soften. You will go into labor. Your baby will be delivered. This is the original design of what God intended for you as a mother. So for you to become pregnant in the month of May, you have to be conversant with your cycle. So you have to take time and study your cycle. So studying your cycle means paying attention to the regularity of your menstrual bleeding. Pay attention to the regularity. So I want you to focus on the keywords. Regularity of your bleeding. So for example, if you have not been doing it, starting from today in May, if you have not bled, when you bleed, mark that first day you bled. That first day you bled is the first day of your cycle. So pay attention to that first day. Now you also need to pay attention to the last day you bleed. The normal bleeding pattern, the normal bleeding duration is for 2 days, up to 7 days. So if you bleed up to 2 days, it's considered normal on the lower limit. If you bleed up to 7 days, it's considered normal on the upper limit. So some women will bleed for 2 days, completely normal. Some women will bleed for 3 days, completely normal. And some women will bleed up to 7 days, completely normal. So you need to pay attention to your pattern. Now, when you pay attention to your pattern, the interval between 2 bleeding months is called a cycle. Now, the normal cycle will range from 21 days to 35 days. For example, if since January You've been bleeding every 24 days. So every 24 days you will bleed, or 25 or 26. You have a regular 25-day cycle. If you've been bleeding every 28 days, you have a regular 28-day cycle. But the normal one is from 21 days to 35 days. So if you bleed every 35 days, is also considered normal. If you bleed every 22 days, is also considered normal. Is when you begin to bleed for less than 21 days or for more than 35 days that you're considered abnormal. So the very first tip, the very first practical thing you can do in 2024 May is to be conversant with your cycle. Now, when you're conversant with your cycle, you can track your ovulation tentatively. Now, you can have ovulatory signs. They are not specific signs. So there are things that will happen to you when the body is about to ovulate, but it's not a confirmation of ovulation. The commoner one out there is increase in your cervical egg white makers. So majority of women, when they come to that point, they will start releasing the egg. The body will start preparing for the release of the eggs. The process of releasing the egg and releasing the egg itself is called ovulation. So for example, if a woman has a 28-day cycle, conventionally on day 14, which is half of that 28, the body will switch, the body will change. And when the body is changing, the hormonal changes will tell the body, it's that time of the month, please release one egg. So before then, there will be changes in estrogen, progesterone, and follicular stimulating hormone and luteinizing hormone. So the follicular stimulating hormone will go to the ovaries and it will start developing one follicle. The follicle will contain the egg that will be ovulated. At the middle, just about the 14th day, there will be increase in the LH. LH is called luteinizing hormone. LH is what will tell the body that the egg is about to be released. So when LH goes up, then the egg will be released within 24 hours. Now you need to pay attention because this is very important. Once a woman has ovulated, that egg you ovulated will be valid and viable for 24 hours. So it simply means we have to get it right with the other part that will lead to pregnancy. So the other part is from the man. So we want to make sure we have availability of sperm. This is why you need to track this. And this is why we don't preach timing, especially if you're above 35 and you have a regular cycle. Regular lovemaking is what is required. So understand your own unique menstrual cycle. Identify the days leading up to ovulation if you have a regular cycle. So there are a couple of things you can do to see if you can pinpoint actually when you ovulate. So you can use ovulation predictor kit. When you're using ovulation predictor kit, you're simply checking the level of luteinizing hormone. So there are a couple of them you can get over the counter. What it will tell you is when the LH goes up, because once LH goes up, within 24 hours, you're going to ovulate. When you ovulate and we have availability of sperm, likelihood you're going to get pregnant. So you can get ovulation test kits. There are some apps, and you can also get a thermometer to check your basal body temperature. When you do this, and you make love regularly, you will improve your chance. So that's tip one. Very effective. It works. Number two, you have to increase the frequency of your love making. If you genuinely want to become pregnant in the month of May, you have to make love regularly. You can't avoid this. It has to be your mantra. It has to be your daily practice. Matter of fact, my last clinic, I actually told women above age 35 to see if they can go every day. Then women below 35 to see if they can go every other day. Let me repeat again. The more you make love in the month of May, the more you will improve your possibility, your chance, your probability, your odds of becoming pregnant. So what we preach for women above 35, everyday lovemaking, apart from likely when you're bleeding. Now, there are some couples that will also make love when they are bleeding. Whatever works for you, just remember if you're 35 years and above, your chances of becoming pregnant is reduced. So what I personally would recommend is every day if you can. Just make it your personal decision, your personal project. Now, below 35, every other day. So aim to have regular lovemaking. Now, if you happen to be younger than 35, and you know for sure that your cycle is 28 days, that your cycle is 25 days, then if it's difficult to follow my instruction, you have to pinpoint your ovulation fertile window. Let me repeat again. If you are younger than 35 and you have a predictable cycle, so for example, you know that every 28 days you will bleed, target your lovemaking around your fertility window. Your fertility window is the time in your cycle when you have the highest chance of becoming pregnant. It will normally open from 5 days to your ovulation and a day after ovulation. So that period of 6 to 7 days is when you have the best chance of becoming pregnant. So target to make love every other day if you are below 35, and every day if you are above 35. So the older you are, the more you have to engage in lovemaking. Unfortunately, that's when you won't have interest in lovemaking. But that's what you need to do naturally in the month of May to increase your chance. Now you have to work on your body weight. You see, your body weight can either help or harm your fertility. So I want you to make sure your body weight is not out of range. There are two extremes. So you can either have underweight. We will normally use the BMI as a criteria for checking if you're underweight, overweight, normal weight, or you have obesity. So we don't want you to be underweight. If we are using BMI as a criteria, a BMI of below 18.5 is considered underweight. We don't want that to be you. We want your BMI to be from 18.5 to 24.9. Of course, we don't want your BMI to be above 25 because that's overweight. And of course, we don't want your BMI to be in the 30s. So what happens when you get to this abnormal body weight? It will affect your ability to have your regularity and to ovulate. So women that are underweight will struggle to ovulate. Women that are overweight will struggle. And of course, women that are in the obesity range will struggle. So you need to control your body weight. How can you control your body weight? Watching what you eat and staying active. You need to work on your stress level. So I've talked about studying your body, knowing your cycle, engaging in regular lovemaking, then talking about maintaining your body weight. The next one is stress. You have to make sure you're in charge of your stress management. If you don't manage your stress, stress can actually affect your ability to become pregnant in the month of May. So there are certain things you previously engage in which will increase your stress level. And when it increases your stress level, you will discover that your hormones are going to be all over the place. So avoid stress. Anything that will give you stress, avoid it because it will impact your fertility. So engage in stress reducing activity like exercises, like yoga, like in promoting your healthy and fertile environment, like going for a walk, swimming, having good company, getting good sleep. These are the things that will help to improve your level of avoiding stress. Now, finally, you have to optimize your preconception health. So there are certain things you need to place yourself on. There are certain things you need to start doing. And there are certain things you need to stop doing as a woman that is getting ready to have a baby. Number one, you have to start taking your prenatal multivitamins. If you haven't started, please start. Every intending mother, starting from today, should start taking their prenatal multivitamins. In your prenatal multivitamins, I want you to focus on folic acid. So make sure your folic acid content is within the recommended range. The recommended range is 400 to 600 micrograms. Now, of course, you don't have any business drinking alcohol completely. So avoid your alcohol, avoid your soda, avoid any other recreational stuff you would normally take. Make water your best friend. So these are things you can do to prepare your body. So remember your prenatal multivitamins for all women intending to become mothers. Start taking it starting from today until you have your baby in your hands. 400 to 600 microgram of folic acid must be inside that prenatal multivitamin. You can't avoid it. No alcohol, no soda, drink more water. Of course, no smoking. You should know that by now. Now, I know some of you might love coffee and all that. Personally, I will want you to reduce, if not stopping completely. Now, when you've done all this, as an intending mother, as an intending father, you need to have a healthcare provider who will help to make sure that you guys are in a good space. So for the woman, you need to retain the services of a gynecologist. So the gynecologist will be in a better position to make sure that you're good to go, to make sure your preconception health is good. So there are a couple of things we need to keep an eye on. We need to keep an eye on your blood. We need to keep an eye on your urine. We need to keep an eye on your general body function, the whole systems, because if anything happens to you as the woman, it can translate to your ability to become pregnant. So bottom line, Remember that every individual's journey to pregnancy is unique. So if you face any challenges or if you have any concerns, call your doctor. Your doctor will examine you, your doctor will evaluate you and investigate, and they will personalize your own approach towards improving your fertility. They will customize it, they will give you the support and guidance you need. I hope this helps. This is just my basic workable tip for the month of May. And if you can follow it religiously, I see you becoming pregnant in the next couple of weeks. So thank you for coming. I'm going to yield and see if we have any questions. So if you have any questions, if you're out there, you can quickly type in your questions so I can provide you feedback. Do we have any questions? Anybody with any question? Okay. So I'm going to quickly say hello to you guys. Let's see if anyone is out there. So I can see one person in attendance. Will you mind introducing yourself? Okay. Okay, you're battling with high prolactin. Now the question is, why should you be battling with high prolactin? If we have already identified that high prolactin is your problem, then we'll give you the corresponding medication. So thankfully, if we diagnose you have high prolactin, so how can we diagnose you have high prolactin? We're going to collect your blood. We're going to check the level of prolactin in your blood. So if we discover you have high prolactin, that condition is called hyperprolactinemia. There are two specific drugs commonly used in treating hyperprolactinemia. One is called cabergoline, the other one is called bromocriptine. So your provider, your fertility specialist, can prescribe bromocriptine or cabergoline. You take it exactly how you want it to take it, and by the special grace of God, your prolactin level will reduce. Now, the problem is, most times we are mono-focused. So we focus on only one problem without understanding there are so many other things that can go wrong that will lead to your inability to become pregnant. So you can have prolactin problems, and you can also have problems in other hormones, and you can struggle with your body weight and other things. So don't just focus on one particular aspect of your infertility. So like what you just mentioned, now you're struggling. I wouldn't want you to use that word. So the question I will ask you is, if you have established with a fertility specialist. So who made the diagnosis of the hyperprolactin? Are you currently under treatment? You see, when you have a doctor that prescribed a drug for treating a particular problem, if you're getting better, you report back to the doctor. If you're not getting better, you report back to the doctor. So for example, if your doctor made the diagnosis of high prolactin and we prescribe bromocriptine or cabergoline for you for a few weeks, and after taking it for a few weeks, your breast is still discharging milk and your prolactin level is not coming down to the level we want, we're going to review. So there are times we need to increase the dosage of your drugs, or we find another alternative drugs. So that's what you need to do. So go back to the doctor that made the diagnosis of the high prolactin. He's going to give you the prescription. You're going to take it exactly how he wants you to take it. Then we're going to evaluate you. So that means when we diagnose the high prolactin, we're collecting your blood. When you're done taking that particular drug, we're going to collect your blood back to check and see the impact of the drug we gave you. Okay? All right. So Enwo Mbianyo, you're the only person in the clinic, so you actually have an advantage. So you need to go back to the doctor that made the diagnosis of the high prolactin, and by the special grace of God, he will review and he will give you alternatives. If you have any other question, please ask before I go. You're privileged, you're the only person in the clinic, so make good use of the opportunity. If you have any other question, please ask before I go. Okay, where are you located? Enwo Mbianyo, where are you located? Do you have any other question? Okay. All right. So I'm going to assume you're good to go, and I have just a few minutes before 20 minutes. So thank you for coming. My next clinic in YouTube will be next Saturday, hopefully. So I'll see you guys. And take good care of yourself and enjoy the rest of your weekend. And bye-bye for now. Okay, you're in Cameroon. Okay, thank you for coming. Enjoy your weekend, and thank you and God bless.